Assalamualaikum viewers and welcome back to my channel Biodenverse Hub. Today in this video we will be discussing about the radiographic interpretation and assessment of the different kinds of facial fractures. We will be studying the basics of the radiographic assessment and also different angulation, patient positioning and interpretation of different radiological views that are used in the oral and maxillofacial surgery for the evaluation and interpretation of the facial fractures. So let us proceed on with that. Okay, so first of all, you need to keep in mind certain key points while going for the assessment of the radiology that is used for the fractures of facial skeleton. So you need to first relate the radiological appearance to the clinical features that will be enlisted and given in the clinical case scenarios. After that, follow the 3 or 4 McGregor-Campbell lines to look for the common fracture patterns. The McGregor-Campbell lines we will be discussing later on in the video in quite detail. Then the most common fracture configurations that are usually found are the isolated zygomatic arch fracture, the tripod fracture and the blowout fractures. You also need to check for the teardrop and eyebrow signs as well on the radiographic assessment. Now let us study some standard views and the advanced views that are used. In the standard views, we have the occipitomental view that is usually taken at 10 and the 30 degrees. And one of the other modification of the occipitomental view is the Waters view. And in that, your angulation is changed to the 37 degrees. After that, we have another view that is known as the Caldwell view, also known as posterior-anterior view. Then the lateral view, segmento-vertex view, that is also known as the bucket handle view. And then the orbital series includes a water views, a Caldwell views, and the 2 oblique orbital views that are used for evaluating the orbital fractures. Then we have some advanced views also available that include your CT scans and CBCTs. Now, how to read and assess the X-rays? While doing that, you need to go for a systematic approach, and that systematic approach is basically the ABC systemic assessment, in which the A basically denotes the advocacy. Now, what is advocacy? Advocacy is that you need to choose the correct view and ensure the correct positioning and exposure. Then the other A that is used is the alignment. You need to check for the Dolan's lines, the McGregor lines, and the Campbell's lines. As far these lines are aligned, they are well aligned. There is no breach in that lines, which will indicate that there is no fracture present. In case of breaching of these lines, that signifies that the fracture is present. Now the B indicates the bone. You need to check for the bones of the midface and above and below the midface as well. That will include your frontal bones, your orbital bones, your ZMC complex, the nasal bridge, then the maxilla and the mandible. After that, the C's indicate first of all the cartilage and the joints. You need to check for the zygomatico-frontal sutures and other sutures as well, and the temporomandibular joint as well. Then S indicates the sinuses. So in case of sinuses, you will need to check for any kind of opacification and polyps that are being present, and also most importantly check for the presence of air fluid levels. Then another S that indicates the soft tissues. You need to look for the soft tissue swellings, the surgical and the orbital emphysemas. So you need to check on for that. After that, we will be discussing the views in quite detail. First of all, we have the occipitomental view, that is also known as the Waters view, and we have studied that standard or there are two kind of occipitomental view. First one was the 10 and the 30 degree view, and after that we have the Waters view, and that is basically at the 37 degree. So Waters view, that is also known as the occipitomental views or peritocanthial projection. It is a radiographic view of the skull. It is commonly used to provide the excellent demonstration of the upper and the middle third of the face, including your orbital margins, your frontal sinuses, the zygomatic arch, and the maxillary antrum. That is basically the maxillary sinus. cavity. So in that case, the position and what we can see is that if we go for the adjacency, so in that an X-ray beam is basically angled at 45 degree to the orbital meatal line. You can see in the diagram as well. There is a line running from your orbit to the external auditory meatus, that is known as your orbital-meatal line, and it is basically the X-ray beam is angled at 45 degree to it. The rays basically it pass from behind the head and they are perpendicular to the radiographic plate, which you can see in the figure as well. Another variation of this is which is known as the water's view. It places the orbital-meatal line at 37 degree. Remember that in first we have studied that X-ray beam is angled at 45 degree to the orbital-meatal line at 37 degree to the orbital-meatal line. Now we will be proceeding on with some anatomical landmarks that are seen on the water view. So as we can see in the radiograph as well, number 1, it is the frontal bone. Number 2, it is the frontal sinus. Number 3, supraorbital rim. Number 4, the orbit. Number 5, the infraorbital limb. Number 6, the zygomatic frontal suture. Number 7, the maxillary sinus. Number 8, the nasal septum. Number 9, the nasal cavity. Number 10, the zygomatic bone. Number 11, maxilla. Number 12, posterior lateral wall of maxillary bone. Number 13, the zygomatic arch. Number 14, the coronary process. Number 15, the condylar process. And number 16, the mandible. So these were some important anatomical landmarks that can be seen on the water view. In the next slide, we have given kind of occipitomental view, that is the water's view. So now let us discuss the McGregor-Campbell lines in quite detail. So it is basically the imaginary lines that are traced across the face on the occipitomental view in order to assess for the fractures of middle third of the face. First line, it is traced from one zygomatic of frontal suture to another across the superior edge of the orbit. The second line, it is traces the zygomatic arch, it crosses the zygomatic bone and then traces across the inferior orbital margins to the contralateral zygomatic arch. The third line, it basically connects the condyle and coronary process of mandible and the maxillary antras on both sides, the left and the right side. The fourth line, it crosses the mandibular rami and occlusal plane of the teeth. The face is inspected for any kind of asymmetry along these lines and also the Dolan's lines. So you need to remember an important point here, that is the first line, it is breached, which means that break will appear due to the step deformity in the superior orbital wall as seen in the black eyebrow sign. And the second line, it is breached in the inferior orbital wall fractures as seen in the teardrop sign. So these were the two important points you need to remember. The first and the second lines can also be used for assessment of any nasal septum deviation as it is assessed in the midline. So there are some pictures of these McGregor-Campbell lines. You can see the red line, the yellow line, the blue line and the fourth line that is shaded in the green color. Okay, so we have another picture of the Campbell's lines in which we are also going to see the fifth line which passes from the lower border of the mandible, and now this line was given by the Trump nail. Now we will be proceeding on with some clinical case scenarios, and the radiographic interpretation will be done of different kind of facial mode fractures. So the first is the water's view given, and you need to go for the alignment, you need to go for assessment of these along the Campbell's lines. You need to check whether these lines are breached or not, and in which region they are breached, on which sides they are breached, which sides you can see the radiolucency or step deformities is present, the fracture line is present. So as in this view, you can clearly see that on the right side the ZMC complex or the zygomatic arch is intact, but on the left side there is a step deformity. There is a break or breached in these lines, Campbell's line, and also the fracture line is quite often visible. There is a break in the continuity of this complex or zygomatic arch that is indicated by the red arrow. So along with this, you will be given out some data about the patient, that is gender is male, 25 years old, and basically the electrocution and punched in the face was a bit description about the traumatic injury that has occurred. So let us discuss another radiograph again of a PA view, water's view. And in that radiograph, first of all, you need to compare both sides, the left and the right sides. Then check out for the alignment along the camera slines. In that, you can see that right side is quite normal, and there is a depression of left orbital floor in keeping with an undisplaced fracture, and a pathognomonic of teardrop sign is present. Additionally, you can also see that is minimally displaced fracture is seen at the lateral wall of the left maxillary sinus, and also an air fluid level in the left maxillary sinus that is indicated by quite a radio opacity is seen, as compared to the right side in which the whole maxillary sinus it is radiolucent. So this was a case of orbital fracture. Now another case we will be discussing is a radiograph of a tripod fracture, that is the fracture of zygomaticomaxillary complex involving the zygomatic arch, lateral orbital wall, and the inferior orbital wall. In that regard, you can also see that on the left side the tripod fracture has occurred along all these three bones. Now we will be discussing another view, that is the submental vertex view. It is an angle inferior superior radiograph of the base of the skull. And now submental vertex view is useful in assessing the foramen magnum, foramen spinosum, the sphenoidal sinus, the cervical spine subluxation, acute trauma, the mandible, and the cervical spine fracture. So in submental vertex view, the patient positioning for procedure totally depend upon how the patient presented. What is the current condition of the patient after the trauma? If it's taken the erect, so the patient leans back on a chair with the back support and faces away from upright bucket. In supine, the shoulders are elevated using a firm pillow, allowing the head to tilt backward. The neck of the patient it is hyperextended until the infraorbital meatal line it is parallel with the receptor, and the skull vertex is in contact with the center of receptor. Ensure that mid-sagittal plane it is perpendicular to the receptor. Now we will be discussing out some views, that is the submental vertex view. So we can see in the radiograph as well, it's clearly obvious that on the left side there is a unilateral left zygomatic arch fracture, also known as the jug handle fracture. Now we have another view, that is the posterior anterior view or the cartwheel view. The cartwheel view is a caudally angled radiograph with its posterior anterior projection, allowing for minimal radiation to the orbits. This view may be used in imaging of the skull or the facial bones depending on the clinical indication. So indication is basically this view aids in visualizing the paranasal sinuses, especially the frontal sinus. It can help to assess the inflammatory condition, that is the sinusitis and secondary osteomyelitis, sinus polyps or cyst. Additionally, the skull fractures, neoplastic processes, the Paget's disease can also be visualized through this view. So in the cartwheel view, the patient positioning is patient it is seated in front of the upright detector. Patient forehead is placed against the image detector. Forehead and nose, they both are in contact or touching against the detector, as you can see in the figure as well. The orbitomeatal line it is running perpendicular to the detector. The petrous ridge it is below the orbits, and you can also see that angulation is almost 15 degree. So it is important to understand the landmarks, anatomical landmarks you can see on the cartwheel view. Pause the video and go through all of these landmarks that can be seen on this view, that is the PA view or the cartwheel view. So we have another pictures as well. Kindly pause the video and go through all of these landmarks. After the PA view, we have another view that is also useful in indicating the facial bone fractures. That is the lateral view of the skull. It is non-angle lateral radiograph of the skull. This view provides an overview of entire skull rather than attempting to highlight any one region. Indication that this projection is basically used to evaluate the skull fractures. In addition to the neoplastic changes in Paget's disease, in trauma setting, a horizontal beam lateral projection may demonstrate the air fluid levels in the sphenoidal sinus as well. That is the indication of the basal skull fracture. So lateral view, the patient positioning for lateral view, it is that the mid-sagittal plane of the patient's head, it is parallel to the image detector, as you can see in the figure as well. The insula turcica is in the profile and the TMJs are superimposed. Here the angle of the X-ray beam, as we can see that it is parallel, so angle is 0 degree. Now you need to know that what are the important anatomical structures or landmarks that can be seen on the lateral view, which is given in this radiograph. First of all, the frontal sinus, then the nasal bone, the maxillary sinus, the maxilla, the mandible. Then we can also see the rami, the condyles, the coronoid process, the sella turcica, the greater sphenoid wing, and the orbital roof can also be seen. So kindly pause the video and go through these landmarks. Now we will be considering some X-rays for mandibular fracture evaluation and assessment. That will mostly includes the orthopentomograph, that is the OPGs. So let us proceed on with that. First of all, you need to know about the important anatomical structures that can be seen on the OPG. So as we are discussing the mandibular fractures, so we can go through that landmarks. It will basically the condyle, the coronoid process, the rami, the body and the angle of the mandible, then the alveolar process, the symphysis and parasymphysis region. So let us study some X-rays for the fractures of mandible. First of all, we have the OPG given, and you can clearly see that you need to compare again the right and the left sides. You need to check out for the symmetry, the alignment, or any kind of fracture line or breach that is seen, or discontinuity that is being seen. So in this OPG, we can clearly see that on the left side, there is a fracture line in the parasymphysis of the mandible. So the parasymphysial region is one of the commonest site for mandibular fracture, either in combination with another fracture or it can also occur in the isolation. In combination, it can occur with the condylar fractures. So here it is the isolated left parasymphysial fracture of the mandible. Now another mandibular fracture we can see is again of the parasymphysial region, but here this view is known as the occlusal view. Now another mandibular fracture is seen in the radiograph, and that we can see at the angle region, as we can clearly see it from both of the images. When it's the radiographic images, that is on the right side, there is the angle fracture. Another very important fracture that can be seen on the radiograph, or that frequently comes in your OSCE examination, is the guardsman fracture. That is the wide displaced symphysial fracture of the mandible. It can be seen in the OPG with bilateral displaced condylar and right coronoid fracture that can be seen in the OPG. Pause the video and go through it. So this was the guardsman's fracture. At last, we have the posterior anterior view of the mandible, which showing the bilateral condylar fractures with also a parasymphysis fracture. Bilateral condylar fractures is indicated by the white arrows, and the parasymphysial fracture, it is indicated by the yellow line. This was all about the radiographic assessment of different facial fractures and a detail of different radiographic views that can be used in the maxillofacial trauma evaluation and assessment. Thank you so much for watching my video. Don't forget to subscribe, like, and share my channel, and also click on the bell icons. You will get notified about the future videos and updates.